As we age, our bodies naturally undergo a variety of changes, and one of the most significant areas affected is the prostate. The prostate is a small, walnut-sized gland that plays a crucial role in the male reproductive system, producing fluids that nourish and transport sperm. As men get older, the prostate can experience different changes, some of which can impact overall health and well-being. For men over 60, understanding how certain activities such as masturbation can influence prostate health is essential for maintaining a healthy lifestyle. Masturbation is a natural and common activity, but its effects on the prostate can vary, especially as we enter our later years. Over time, the prostate may enlarge, become more sensitive, or experience a decrease in its ability to function optimally. This makes it even more important to be informed about how masturbation might affect the prostate and to make choices that support prostate health. In this video, we'll dive into 6 significant changes that may occur in your prostate as a result of masturbation, and we'll provide valuable tips on how to maintain good prostate health as you age. By understanding these changes and how they can affect your body, you'll be better equipped to make informed decisions about your sexual health and overall well-being. Whether you're concerned about potential discomfort, changes in urinary habits, or simply want to understand how your prostate functions as you age, this video will give you a clear picture of what to expect and how you can take proactive steps toward better health. First, let's talk about prostate size. As men age, the prostate naturally undergoes changes, and one of the most common changes is an increase in size, a condition known as benign prostatic hyperplasia, or BPH. BPH is a non-cancerous enlargement of the prostate gland that typically occurs in older men. This enlargement happens gradually over time and is considered a normal part of the aging process. However, when the prostate becomes enlarged, it can exert pressure on the urethra, the tube that carries urine from the bladder out of the body, leading to various urinary symptoms. These symptoms can include frequent urination, especially at night, difficulty starting or stopping urination, weak urine flow, and a feeling of incomplete emptying of the bladder. Masturbation, in some cases, may exacerbate these symptoms, especially if the prostate is already enlarged. After ejaculation, some men with BPH may experience temporary discomfort or even mild pain in the pelvic area or lower abdomen. This can occur because the prostate is actively involved in the process of ejaculation, and when it is enlarged, the increased pressure may lead to a sensation of fullness or discomfort. It's important to pay attention to how your body responds after such activities, as any persistent or worsening symptoms should not be ignored. If you notice an increase in urinary frequency, pain, or discomfort after masturbation, it may be an indication that your prostate is experiencing more strain than usual. Keeping track of any changes in your symptoms can help you and your healthcare provider better understand your prostate health. Regular checkups with a doctor are recommended to monitor prostate size and function, especially as you age. By staying informed and aware of how masturbation and prostate enlargement can affect your body, you'll be better equipped to take proactive steps toward maintaining good health and reducing potential discomfort. Second, regular ejaculation, whether through masturbation or sexual activity, has been shown to be linked to better prostate health. While many men may feel unsure about how sexual activity or masturbation could affect their prostate, research indicates that frequent ejaculation may actually play a protective role in maintaining prostate function. Studies have suggested that regular ejaculation helps to flush out toxins and potentially harmful substances from the prostate gland. This process may help prevent the buildup of these substances, which could otherwise lead to inflammation or other prostate issues. In particular, regular ejaculation can help to clear the prostate of excess fluids and stagnant substances that accumulate over time. This may reduce the likelihood of developing conditions such as prostatitis, a painful inflammation of the prostate, or benign prostatic hyperplasia, BPH, which causes the prostate to enlarge and affect urinary function. Frequent ejaculation has also been linked to a reduced risk of prostate cancer, although more research is still being conducted to fully understand the relationship. It's important to note that, while studies suggest that regular ejaculation could be beneficial for prostate health, balance is key. Excessive or compulsive sexual activity may still have its own set of concerns, and every individual's health needs and experiences are unique. However, If you're engaging in regular masturbation or sexual activity, there's no need to feel concerned about it negatively affecting your prostate health. In fact, it might be helping to support and maintain optimal prostate function over time. By maintaining a healthy sexual routine, including regular ejaculation, you may be contributing to your prostate's overall well-being. Of course, it's always important to monitor any changes in your body and consult with your doctor if you have concerns. But in general, regular, moderate ejaculation could be an important aspect of prostate health that many men may not fully recognize. Third, as we age, the prostate can become more sensitive, which may lead to a variety of experiences for some men. As men enter their 60s and beyond, their bodies undergo various changes, and the prostate is no exception. This increase in sensitivity may be related to natural age-related changes in hormone levels, blood flow, and the general health of the prostate. The prostate may react more intensely to sexual activity or stimulation, which could cause discomfort, mild pain, or even a feeling of fullness or pressure in the pelvic area. In some cases, this heightened sensitivity can result in discomfort or pain during or after masturbation. It's important to understand that this kind of sensitivity is often a normal part of the aging process, but it can also be an indication that your prostate may require more attention. For instance, if there is an enlargement of the prostate, as seen with benign prostatic hyperplasia, BPH, it may become more tender or uncomfortable to the touch, especially after ejaculation. Other factors, such as changes in muscle tone or nerve sensitivity, can also contribute to these sensations. Some men may notice that the prostate becomes more sensitive to pressure, or that certain activities, like masturbation, can trigger discomfort or a dull ache. While this sensitivity is often temporary and can be managed with lifestyle adjustments, it's important to be mindful of any persistent pain or discomfort. If you notice any ongoing or consistent pain, or if the discomfort becomes more severe, it is essential to consult with your healthcare provider. Pain that lingers or intensifies might be a sign of an underlying condition, such as prostatitis, which is an inflammation of the prostate, or other prostate-related health issues that may require medical attention. Regular checkups with your doctor can help ensure that your prostate health is being properly monitored and managed. Being proactive about any discomfort you experience and seeking advice from a medical professional can help you better understand the changes occurring in your body as you age. While sensitivity in the prostate is common as men get older, taking action to address any pain or discomfort early on can contribute to maintaining overall health and preventing more serious problems from developing. Fourth, masturbation can have an impact on your testosterone levels, which naturally decline as men age. Testosterone is a key hormone responsible for many important functions in the body, including maintaining muscle mass, bone density, mood, and overall vitality. It also plays a crucial role in maintaining prostate health, as it helps regulate the growth and function of the prostate. As men age, testosterone production gradually decreases, typically starting in their 30s or 40s, and this decline can become more pronounced as they enter their 60s and beyond. Testosterone levels naturally fluctuate throughout the day and can be influenced by a variety of factors, including physical activity, diet, stress, and sexual activity. Masturbation, in particular, may cause a temporary drop in testosterone levels, but the effect is typically short-lived and doesn't have a significant or lasting impact on overall testosterone production. This means that occasional masturbation is unlikely to have any long-term consequences on your testosterone levels or prostate health. However, it's important to note that consistent or excessive changes in testosterone levels may affect overall health and well-being. If you start to experience symptoms such as low energy, reduced libido, or a decrease in muscle mass, this could be related to a hormonal imbalance or a more significant decline in testosterone levels. These symptoms are not uncommon as men age, but they can also indicate an underlying issue that may require attention. For example, low testosterone levels can contribute to feelings of fatigue, depression, and a lack of motivation. In some cases, men may also notice a decline in their sexual drive or difficulty achieving or maintaining erections. If you notice these changes in your body, it could be a sign that your testosterone levels are lower than they should be, and it's worth discussing these symptoms with your healthcare provider. A blood test can measure your testosterone levels, and your doctor may recommend treatments or lifestyle changes to help manage any hormonal imbalances. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and adequate sleep, can help support healthy testosterone levels as you age. Additionally, avoiding excessive stress and practicing stress-reducing techniques, such as meditation or deep breathing exercises, can also play a role in regulating your hormone levels. Ultimately, while masturbation itself doesn't have a significant effect on testosterone, changes in your hormone levels and overall well-being are worth paying attention to and can be managed with proper care and guidance from your doctor. Fifth, regular sexual activity and masturbation are believed to play a role in reducing the risk of prostate cancer. Research has shown that men who ejaculate more frequently, whether through sexual activity or masturbation, may have a lower risk of developing prostate cancer. This connection is thought to be linked to the way ejaculation helps keep the prostate healthy by clearing it of potentially harmful substances and toxins that can build up over time. Ejaculation promotes the natural flushing of the prostate, allowing it to rid itself of fluids and other substances that could otherwise accumulate and potentially lead to problems. This process helps to maintain prostate function and reduces the chances of inflammation or other conditions that might contribute to cancerous changes in the prostate. While the exact mechanisms behind this relationship are still being studied, some studies have suggested that frequent ejaculation might help maintain a healthy balance in the prostate, thereby supporting its long-term health and potentially lowering the risk of developing cancer. The idea that regular ejaculation can lower the risk of prostate cancer is supported by several studies that have looked at the frequency of ejaculation and its association with prostate cancer risk. One study published in the journal JAMA, Journal of the American Medical Association, found that men who ejaculated 21 or more times per month had a lower risk of developing prostate cancer compared to men who ejaculated fewer times. While this does not definitively prove that ejaculation prevents prostate cancer, it does suggest that frequent ejaculation may be a protective factor. Additionally, it's important to note that while regular sexual activity or masturbation can support prostate health, it should be viewed as just one part of a broader approach to maintaining overall prostate health. A healthy lifestyle that includes a balanced diet, regular exercise, and regular checkups with a healthcare provider is also essential for reducing the risk of prostate cancer and promoting long-term prostate function. While the benefits of ejaculation on prostate health are still being studied, these findings indicate that engaging in regular sexual activity or masturbation may offer potential benefits beyond sexual well-being. Maintaining a healthy frequency of ejaculation could be a simple and natural way to promote prostate health as part of a holistic approach to aging and overall wellness. It's also important to note that prostate cancer is influenced by various factors, including genetics, family history, and lifestyle choices. While regular ejaculation may play a role in reducing risk, it is not a guarantee against prostate cancer. It is crucial for men, especially those over 60, to discuss their prostate health with a healthcare provider, undergo regular screenings, and address any concerns they may have about their prostate health. Lastly, if you have an existing prostate condition such as prostatitis or prostate cancer, it's essential to be particularly mindful of how masturbation may affect your symptoms and overall health. For men with prostatitis, which is the inflammation of the prostate, masturbation can sometimes exacerbate symptoms, leading to increased discomfort, pain, or irritation. This is especially true if the prostate is already inflamed, as additional stimulation can aggravate the condition. The friction and pressure that occur during masturbation may contribute to swelling or tenderness, potentially causing more frequent urinary problems or pelvic discomfort. If you're experiencing prostatitis, it's crucial to listen to your body. You may notice that engaging in sexual activity or masturbation may worsen your symptoms or trigger a flare-up of the condition. In these cases, it might be beneficial to reduce the frequency of masturbation or explore other ways to manage prostate health under the guidance of a healthcare provider. A doctor may recommend lifestyle changes, medications, or even physical therapy to manage the inflammation and alleviate discomfort. For men with a history of prostate cancer or those undergoing treatment for the disease, it's also important to consider how masturbation might affect your symptoms and treatment process. While some men with prostate cancer may not experience noticeable changes in their ability to engage in sexual activity, others may find that masturbation can be uncomfortable or cause pain, especially if they are undergoing treatments like radiation or hormone therapy. These treatments can impact testosterone levels and alter the function of the prostate, so it's essential to be aware of how your body responds. In some cases, men with prostate cancer may experience erectile dysfunction, changes in libido, or other sexual health issues as a side effect of their treatment. These changes can also influence how masturbation feels and how frequently a man engages in it. If you're undergoing treatment for prostate cancer and find that masturbation causes discomfort, pain, or distress, it's important to discuss these changes with your healthcare provider. They can offer advice on how to manage these side effects and help you navigate the complexities of maintaining a healthy and comfortable sexual life during treatment. In addition to physical symptoms, men with prostate conditions may experience emotional or psychological changes, such as anxiety or frustration, when dealing with prostate health issues. Masturbation may serve as a way to cope with these emotions, but if it causes pain or discomfort, it may contribute to a negative cycle of stress or worry. Being proactive about discussing any emotional or physical concerns with a healthcare provider can help you manage prostate health more effectively and reduce the impact of these conditions on your quality of life. Ultimately, if you have an existing prostate condition, it's always best to consult with your healthcare provider for personalized advice tailored to your specific situation. They can help you understand how your individual condition may interact with sexual activity and offer guidance on how to maintain a healthy balance that supports both your physical and emotional well-being. Regular checkups and open communication with your doctor are key to managing prostate health and ensuring that you receive the most appropriate care. In conclusion, masturbation after 60 can affect the prostate in various ways, but it's generally safe and even beneficial for prostate health when done in moderation. Regular ejaculation, whether through sexual activity or masturbation, can help to flush out toxins from the prostate, reducing the risk of certain prostate issues. However, it's essential to listen to your body and pay attention to any changes that may occur. If you experience any pain, discomfort, or noticeable changes in your urinary or sexual function, it's important to seek medical advice as soon as possible. These changes could be signs of underlying conditions that may require attention, and early detection can significantly improve your quality of life. Proactive management of your prostate health is crucial as you age. This includes maintaining a healthy lifestyle, staying physically active, and discussing any concerns or symptoms with your healthcare provider. Regular checkups, proper diet, and open communication with your doctor will help ensure that your prostate remains healthy and that any potential issues are caught early. By staying informed and being mindful of your prostate health, you can continue to enjoy a healthier, more comfortable life as you age. Remember, taking small steps to care for your prostate today can lead to a more fulfilling and active tomorrow.